Okay, hello, Dr. Wong. We're here today to talk more about the COVID-19, and we see a lot of people asking, will there be vaccines coming out soon, and how long do you think this will last? Yeah.
Okay. Actually, I think eventually we will need a vaccine to protect the population from infection. Of course, what we are doing now, for example, social distancing, wearing masks and hygiene measures are important. No matter whether you're vaccinated or not, because there will be other infectious diseases in the coming decades. Who knows? But anyway, for the COVID-19 vaccine, actually now if you go up onto the WHO website, there are over 140 candidate vaccines being tested at various phases. Usually it works out like that. For the testing of a vaccine, there will be preclinical tests on animals for safety. And then a phase 1 clinical trial will be for less than 100 people, for example, to test for the safety of the vaccine. And then phase 2 will be thousands of people, and then we'll test the dosage that will be used and the safety of the vaccine. And then at the final phase of phase 3, there will be thousands or tens of thousands of people being tested for safety and also for the efficacy of the vaccine.
Okay.
To be effective, a vaccine has to be more than 50% protection to be quantified as an effective vaccine. Okay, and now there are around 3 to 4 phase 3 trials of vaccine trials. Okay, and in the data which are being released by some of these vaccine trials, the antibody which they can generate from the vaccine is quite high, and also it's quite safe. And the overall the authorities in the world now think towards the end of this year or early next year, there will be 1 or 2 candidate vaccine being available to people to be vaccinated. But whether this vaccine can produce long-lasting immunity is something that we have to further follow up. Because, for example, now the people who are vaccinated, we have to measure their antibody, the amount of antibody serially, then to know about the duration of protection.
Okay, so for these phase 3 trials, so do they have to wait a long time to make sure it lasts a long time, or they can push it out earlier, faster, and wait and see approach?
Usually, they will. I mean, now we are in this global crisis. I think usually, actually, for a vaccine to be commercialized, it will take years. But this time it was super fast track. Okay, because the whole world, all the countries are putting all the resources into developing the potential vaccines. Likely, of course, they can do sort of projection, after the initial few months, to know whether the decline or decay of the antibody is rapid. But I think the priority now is to develop a safe and reliable vaccine, and so to vaccinate especially the high-risk groups, meaning the people who are prone to severe complications of the COVID-19, for example, the elderly and the people with chronic diseases, or people who handle those people, for example, the healthcare workers. I think that is a priority.
Okay, so before we have these vaccines, we still going to do our safety, social distance, wear masks, wash our hands, and all this.
Of course.
Okay, so we're waiting. Still need to wait maybe half year to a year before things get back to normal. You think?
Yes.
Okay. Okay, that's all for today. Thank you.
Thank you.
Thank you.